People trying to recover from the experience of homelessness need stable housing, but they also need other kinds of help, especially for mental health. That's increasingly part of the mission at St. Francis House. To tell us about new efforts there is its Associate Director of Behavioral Health, Molly Dugan. Thank you very much for being with us, Molly.
Thank you, Chris, for having me.
Well, I want to talk about the part of this that you specialize in, because one term that we're hearing maybe more of lately is harm reduction. So you're helping people with that. What exactly does that mean?
Well, it's a big concept that we take into account here, and the general philosophy behind harm reduction is that we respect a person's right to self-determination in whatever that means. And our role as providers and people who are here to support along the way is to make sure that people have all of the information and access to resources that they need so that they can access it when they want to. For some people, they're going to want to engage with different parts of recovery in different stages, and some people aren't going to be interested in recovery long term. And that's totally fine. We want to respect wherever someone is in the process and make sure that whatever they need in that moment is something that's accessible and something that ultimately helps them stay safe.
No, I know this must be frustrating for people, because we've heard stories about people who have substance use disorder. There are efforts to get them into recovery, and there are lapses, and then people try again. What's it like to be a worker in that situation? Because you're going to be having all of these disappointments. So what keeps them going at it?
I think one of the things is continuing to reframe for ourselves and the people that we serve that it's more of an opportunity than anything. Every time that we get to interact with a person is an opportunity instead of a disappointment. It's a time to try something new, to explore what didn't work before. And for a lot of people, the process of recovery is not a straight shot. It's never been a very linear process. And so we get the privilege of working with people in wherever they are in that moment and being able to help them shape that and understand that this isn't a step back. It's just maybe a step sideways or an opportunity to learn something that you didn't know before. Because that's the space that we have to hold for people sometimes, is to navigate those disappointments and show them that that's not how we feel and that we can help them toward a next step.
Tell me a little bit about how your behavioral health workers interact with people, because I have a feeling that you don't just sit there and wait for somebody to come in. You actually have to go out and find people where they are, don't you?
Absolutely. And I mean, that's one of the things that I really like about St. Francis House is that anyone who does come through the door, we're already meeting them where they are just by virtue of the kind of services we've been providing here. Part of our newer initiatives are involved in the harm reduction programming that we're doing here. So we have two outreach workers who split their time between doing outreach in the community, which is something that a lot of other organizations in the city of Boston are already doing and doing well. So we are just an added piece of something that's already really strongly connected with the community. So we're engaging people around the area in downtown Boston, between South Station and the Commons and everywhere in between, making sure that people know who we are, what kind of services we have here, and then again, even integrating them within the building. So sometimes there are people on different floors of the building who aren't aware of what kind of services we might be able to provide and how we can be helpful. So we're doing a lot of that legwork even in our own system, which has been really exciting.
I imagine harm reduction could, among other things, mean helping people continue to use a drug, but maybe in a less dangerous way. Is that part of the mix as well?
Absolutely. Absolutely. That's a really big piece of it. And I know for some people that can be one of the harder things to conceptualize. And I think it's a reflection of where we are in addiction treatment at this point in time, is that it's not so black and white. And when we can appreciate that there's more of a spectrum, then we're actually being more productive in the way that we interact with people. And so things as simple as educating people on where they can get clean needles, any kinds of medication that they can use that would be helpful to decrease cravings or anything like that. Anything that's ultimately going to reduce the risk of overdose or infectious disease spread, anything that's going to help keep people safe is something that we're interested in, because we know that everyone's journey is different and people aren't always going to go immediately into abstinence. It's just a little bit harder than that.
I know there are many encounters here that end up turning out badly at some point, but what about the ones that turn out better, where someone gets on track and eventually becomes self-sufficient? Do you see some cases like that, and maybe have some idea of what makes it work?
We do. We absolutely do. I think the thing that makes it work, because it's a really complicated recipe to pull together. And some of it is, intrinsic motivation. What's in that person that's making them interested in this path at this time, and all of that can be really contextual. But ultimately, I think showing that, as a provider, you're someone who is trustworthy and non-judgmental, that's what's going to keep someone coming back to you. So if you are in an experience with someone, and this is something that I've dealt with a lot when people are managing relapse, the first thing I always want to talk about is how to navigate the experience of shame and how to continue to support them in feeling resilient and knowing that even though this is something they're experiencing now, it's not a forever moment. It's something that's situational. That's something that I really connect with in my work with people, is making sure that they know that I'm not here to judge them. I'm just here to support them in the moment. And that strong relationship building, I think, is what keeps people connected.
I know you sound like you do have this long experience working in this area with people struggling with addiction. But what made you choose this as your field?
I think most people who are in this field have some connection with it, in terms of personal experience, lived experience. And so just being on the periphery of it for much of my life and seeing people that I love and know, friends and family connected with it, I always felt really curious about it and inquisitive about it. And I actually went to BU School of Social Work and got connected with a field placement there that really opened my eyes to what treatment looks like. And the place that I was working was really focused on harm reduction care, and so that was my first exposure. And it's just something that I felt like was so natural and I really connected with, and it's pushed me to think about how to continue to explore that and create more opportunity for people. But it is a field that I think people get into it because there's a personal connection.
I want to take you beyond the personal to maybe the bigger picture,
Mhm.
because I've seen some indications that things are getting worse, even just over the past year, let alone the opioid crisis per se. Do you see sense that things are at least are worse in terms of just sheer numbers of people?
I do. The numbers are up in that sense, but then what I also find, that gives me encouragement is, in response to the numbers are the people behind the scenes who are doing a lot of work to be really creative in how we approach that. I don't know if doing something like our harm reduction specialists who are doing all of this outreach would have been possible, 2 years ago, because it's in response to something that is big and constantly changing and developing. So the idea that there are people who are willing to be flexible, and to change maybe some of the more traditional models of approaching treatment or even engagement, that feels, like something that is on the upward trend.
Finally, Molly, and I know what you do has to be combined with other things, especially housing. But if people want some more information about St. Francis House, is there any place where they should look for that?
Absolutely. I mean, they can check on the website, but also I find that just knowing the kind of services that St. Francis provides, people are welcome to come into the building. We have case managers of the day on site Monday through Friday, 7:30 in the morning until 11:30, and then from 12 to 3, except for Wednesdays when we close early. We find that that kind of in-person connection is something that was really missing during the pandemic, and something that we'd like to strengthen as we go forward. And you can also follow us on Instagram, and Facebook.
Thank you very much for taking the time to be with us.
Yeah, thank you.
It's Molly Dugan from St. Francis House. We'll have more news in just a moment.